For the last 14 seasons, I've been the radio voice of the Washington Capitals. That's a long time, and I'm not a young man anymore, and it's very important to get screened for colon cancer. I had not done it yet, and I did, at the recommendation of my doctor, have a colonoscopy. I expected the results to be fine. They weren't. I had a mass in my colon that was cancerous. I would need surgery. I would lose a foot of my colon through the process. And luckily, the news for me was good. The surgery was enough. I did not need chemotherapy or radiation, just regular checkups moving forward. But it scared me enough to give you this message. If you are 45 or older, man or woman, you need to get screened for colon cancer. It quite literally saved my life, and it could save yours as well. Earlier this month, I sat down with the doctor that actually performed my surgery, Dr. Preetha Ali at MedStar Health. We talked about my experience and why you should get tested for colon cancer. Dr. Ali, this isn't a place that I thought I would have been a few months ago. I did not in a million years imagine that I would have gone in for my first colonoscopy screening and found out that I had colon cancer. But that's something that it happens a lot more than people think. Absolutely. And I guess as far as awareness goes, that's really the biggest key, right?
Yeah, absolutely. I mean, we've actually recently, in the last 5 to 10 years, reduced the screening age to 45 because we find that it's important to screen earlier because we can catch those abnormal growths of tissue that are called polyps that probably most people have heard about. So by removing those, it dramatically reduces your risk of developing colon cancer.
And look, you say 45, I'm 51, and I said, oh, it's time, I should do that. And you hear the word cancer, it's a frightening thing.
Absolutely, and you're right, it is a very scary time. It affects men and women equally. It's about a 4 to 5% risk in the general population. That's without any family history, because actually inherited colorectal cancer is a very small percentage. It's more sporadic. So that's why it's so important to make sure that you don't ignore it, don't put it off, get screened early. I tell all my patients, while colonoscopy sounds super annoying, colon cancer is way more annoying, so yes. It's better just to go ahead and get screened.
There wasn't a thing wrong with me. I felt great, and then you're hit in the face with, you have colon cancer. And for me, I was in denial. I was like, this is somebody else, they messed up the test, how could this possibly be me?
Yeah.
But that kind of tells a little bit of the story here too, is like, just because you don't feel anything, everything's fine, you might not be.
It's a pretty silent disease. That's why, there are nowadays, luckily, even more options for screening. There's even stool tests that people can do. There's colonoscopy, which is what we always recommend because we can actually remove those precancerous lesions at the time of scope. But there are so many options to get screened, and you're right, it is a very silent disease, so you don't necessarily even have to have symptoms.
I can't thank you enough for everything that you did for me and for my family, and I can't thank you enough, Dr. Ali. Thank you so much.
I appreciate it. You were such a pleasure to take care of, and you were a model patient, which was very easy, so it was great.
Dr. Ali, thank you so much.
Of course, anytime. Thank you.